guys, you're welcome back to my channel. Thanks so much for tuning in. So today we're going to be talking about coronavirus and how it relates to pregnant women. I understand as a pregnant woman you might be a bit concerned about how it affects you, especially if you're in your first or second or third trimester. Irrespective of the trimester you are in, it is okay to feel like you've got a bit of panic moments. It's fine. I was that way when I was still at work, but now I'm on my annual leave, which will then run into my maternity leave. Moving forward, I'd like to first remind us what the coronavirus is. According to the World Health Organization, coronavirus is a family of viruses which causes illnesses in humans as well as in animals. And in humans, several coronaviruses are known to cause simple illnesses like common cold to severe ones like the Middle East respiratory syndrome, as well as the severe acute respiratory syndrome, which are very deadly. Those two ones, they are not. The second one, like the severe acute respiratory syndrome as an example, is not highly infectious, but it is more deadly than the COVID-19. But the one recently discovered, well, not recently anymore, which originated from Wuhan, is the one that we all know about, which is the coronavirus disease COVID-19. So I've intentionally started from the family group and then streamlined it, because at some point I will be mentioning the Middle East respiratory syndrome as well as the severe acute respiratory syndrome as we get along. So please remember to subscribe to this channel. Remember to like this video if you do at the end of it all, and remember to put a comment down if you've got anything to say, like an addition, or if you've got any questions to ask. Thank you. So moving forward with the definition of the coronavirus disease, the COVID-19 itself, it is a respiratory illness that is infectious, and it transmits or it transfers from human to human through droplets. So the mode of transmission is through droplets. And what do I mean by that? So the direct way of transmitting, of the direct way of contracting this virus, is when somebody who's got the virus coughs, sneezes, or speaks into you, and you are within the 1 meter to 2 meter range, and they drop. Of course, when people talk, some people spray droplets, and there is a droplet being sprayed into your mouth, your eyes, or your nose. And what this virus needs pretty much is a mucous membrane to activate. So because this virus has been found to be heavy, it doesn't stay in the air. So it is not an infection. It is not airborne, like you won't find it in the air if somebody had been there who is infected. No, so it normally drops to whatever surface it's fine. So if it sprays to your face, and if there's nobody there, it sprays to whatever surface around it that it can find. So that's pretty much where the direct and the indirect mode of transmission comes to play. So I've talked about the direct way of contracting it, and the indirect way is, imagine when it drops on a table surface, or on a cup, or on a plate, or on a bag, a carrier bag, or whatever it is, and you then go there, you then pick it up, and you, without realizing, by so doing, you then probably, after touching the cup or touching the plate, you then use it to drink water, or use the same hand without washing it to rub your eyes, and that way it comes in contact with the mucous membrane, and the virus then becomes activated. So that is why we are being encouraged as much as possible to keep washing our hands, or keep using hand sanitizer, alcohol-based hand sanitizer. And also we are being encouraged to clean our surfaces with disinfectant wipes. And also we are being encouraged as well not to touch our faces. And another indirect way is if the person with the virus themselves cough or talk in their hand, and then it touch infected surfaces, and you then go there. So that's another way. So I haven't talked about the mode of transmission. I will be running quick into the effects on pregnant women as well as the effects on the fetus, that's the unborn child. According to the gov.uk publication, pregnant women are one of the 10 people listed as being in the vulnerable group or the risk group, and not because there is a scientific evidence to show that being pregnant particularly makes you more susceptible. But because the state of being pregnant comes with reduced immunity, and the way the body would normally tackle a virus or an infection if it wasn't pregnant is not the same way it would because it is now pregnant. That is why pregnant women often fall in the vulnerable group or the risk group, and that's why they fall in it in this instance. Also, I will then talk about pregnant women according to their trimesters, if you understand what I mean. So according to the documentation of the evidence provided on the Royal College of Obstetrician and Gynecologists, pregnant women in their first and second trimester of pregnancy were found to have contracted this virus even in the UK, and were admitted, and their symptom presentation as well as the treatment response was found to be very great. However, no information is provided as to whether a woman in her third trimester of pregnancy has been admitted following contracting this disease. Nothing has been said about that. But the only reason that women in their third trimester are particularly being exempted from work if possible is because, remember, I mentioned the family of the coronaviruses. I mentioned the SARS as well as the MERS. So the reason is because comparing women in their third trimester who contracted SARS and who contracted MERS, their risk of losing the pregnancy or their risk of having preterm birth was really great. It's really made them fall in the very high risk group, and that's why they've compared somebody who is in their third trimester of pregnancy infected with coronavirus with SARS and MERS, if you understand what I mean. So they've used a useful comparator. So there is no evidence showing that there has been indeed a third trimester woman or woman in her third trimester contracts this disease. So having said that, I will then move to the effect of this virus on the fetus. So currently there is no data showing increased risk of miscarriage or preterm birth in relation to COVID-19, and there is no evidence showing as well that this virus is transmissible from mother to child while the child is still in utero. That's while the child is still in the belly, that's in the uterus. And because this virus is normally transmissible via the IgM, and IgMs normally don't cross the placenta barrier, they don't cross from child to mother via the placenta. So for that reason, there is no evidence to show that you can pass it to your child should you have it. However, in China, they recorded 2 neonates that were found to have contracted the coronavirus disease. The disease was found in their serum. So, but they still can't say that it was passed through the mother because the placenta cord blood was tested, the placenta itself was tested, it was swabbed, the breast milk itself was tested, and pretty much everything around the mother was tested, and everything came back negative. So whether or not the child or the neonate contracted it outside of the mother, peradventure on the sheet or wherever it was, or it was the child's immunity response while in utero, nobody knows. But that data remains as it is, and it's been mentioned on the Royal College of Obstetrician and Gynecologists website if you want to have a look. So that's the effect on the fetus. So next I'm going to be talking about what happens to my job. So if you are in your first, second or third trimester of pregnancy and you're a bit worried, especially if your job is patient facing, then it is very important that you speak to your manager, speak to your occupational health team, and speak to them about what's going to happen. So if you can work from home, they will let you know, and if you cannot, they should normally, according to the gov.uk website and the Royal College of Obstetrician and Gynecologists website, you should normally be able to modify your role in such a way that you don't come in contact with patients that have been tested positive to the coronavirus disease. I've got friends who are in their first trimester, second trimester, and they've said to me, occupational health team managers told them to still keep coming to work. They are not part of the categories to stay away from work. And I've got a colleague in her third trimester and she's been asked not to come to work at all. So she's been on sick absence since the start of all of these things. So she was in her 30 weeks, I believe, and she's been asked to stay at home from 30 weeks, and they will then move her annual leave forward, then move her maternity leave forward. There will be a modification to everything because she is in her 3rd trimester. There was a petition going around at some point last month or something, around including every pregnant woman and not just the ones in the 3rd trimester. But then that still boils down to the evidence I mentioned about on the one on the website around why 1st and 2nd trimester pregnant women are considered okay to still continue with their jobs, if you get what I mean. So that's what's around job. So another frequently asked question is, can I breastfeed my child if I'm positive? Yes, like I said, there is no evidence to show that you will transfer it through breast milk, and you need that bonding with your child. You need that the vitamins, everything, the oil, minerals, everything that the child needs to get from your breast milk at that point in time is highly essential. So that benefit outweighs the cost of not breastfeeding, if you get what I mean. So using the cost benefit analysis, it is highly important that you breastfeed your child, please. And speak to your midwife, speak to somebody, do not keep quiet. Oh yeah, so another question that could be asked is, should I attend my antenatal classes or antenatal appointments? Firstly, I need to mention that maternity care is really essential in the early detection, for prevention, and even for treatment of any problems or any complications that may arise with mother or with baby. So having said that, it is highly important that you attend every of your appointments with your midwife or with your doctor if you feel well enough to do so. However, if you don't feel well because you feel you're coughing or it's just general unwellness, do let them know so they can reschedule you. But if you think the unwellness is related to any of the signs of the COVID-19 disease, then please ring 111, or ring the midwife, ring your GP surgery, and just let them know how you feel. So next thing is advice regarding social distancing and social isolation. So the same social distancing and social isolation guidance as found or as provided for us all on the gov.uk applies to you as a pregnant woman as well. We all should stay at home and try to limit our outings to buying of essential commodities only. It's just better to be safe than sorry. So, and speaking of social distancing, 2 meters, even if you have to go out, you have to maintain the 2-meter rule. Do not be close to anybody, do not have anybody talking to your mouth and all of that. It is very, very important. So speaking of staying active, the next question is, how do I stay active as a pregnant woman, especially if you're in your 3rd trimester and you're getting ready for labor? So it is important that you try your best to do exercises as you can, or as your body would allow you. It's better if you've got, especially if you've got any underlying condition, to speak to your doctor or your GP surgery or your midwife or somebody. Speak to them first before you do any kind of exercise. That way you know you're safe to do so. And remember to follow your body, obey your body, follow your instincts. You can use an open space in your living room, in your room, in your spare room, in your garden, and it's lovely and sunny these days. You can use anywhere. Just make sure you stay in the perimeter of your own house. And that would lead me to my next video, which is talking about exercises that pregnant women in their 3rd trimester can do to ease labor. So I'll be talking about 10 simple exercises, and if you please subscribe, press notification button, you will know as soon as I release that video, and that way you can watch it as well and stay active with me. So that's pretty much everything. I hope I've covered everything I plan to cover around frequently asked questions.
Losing time, I'm fading fast. I just wanna make it last. Try to let go of the past. I close my eyes, embrace the blast. Sleepless nights and headaches stack. Restlessness to hell and back. What's my purpose? What do I grab? A slippery surface, a heart attack. And sometimes you just gotta believe there's something that'll give you relief.